So where are you now? You are in Thailand, or
Yeah, I'm in Thailand right now. It's about 4 p.m. And yeah, and how about you? You're right now you stay in Poland, right?
yes, right now I'm in Poland.
So what time is it actually?
It is uh, it is 10 o'clock morning.
Ah, good. Very nice time.
Nasim, can you hear?
Yes, I can hear
Okay.
you, sir.
Okay. So welcome, Professor Ruttiya. Hello, I'm
Hi, very
Ram B. Bhagat.
Professor Barkat. Very privileged to meeting you. Thank you. Thank you for accepting my request. I'm really excited to be joining this
It is
conversation in
our,
this.
it is our pleasure that you joined and accepted to deliver the lecture. Wonderful.
So, Professor Ruttiya,
Yes.
do you have any slides?
Oh, yeah, I can share from my side, or would you like me to send
You
the
can
slide to you?
you can share yourself, but would you like to check it because we have 1 more minute? So maybe, uh, yeah.
Yeah, I think it should be a fine. Sharing from my side.
Okay, great then.
Thank you.
I can see Professor Smith also joined. Professor Smith, yeah, it's on mute, so I can't hear you.
Here we are. Good morning, Nassim. Good morning,
Uh,
everyone.
good
Delighted to
morning.
join. Morning.
Thank you very much. Professor Sumit, nice to meet you. Yeah.
So, to be honest, it's already 3 minutes late. I don't know, Professor Bhagat,
We
you
can
are on
start.
mute. Okay.
We can start.
Yeah.
Santosh has also joined. Good. Welcome, Santosh.
Good afternoon, everybody.
Good afternoon.
It's a struggle. Has
morning.
the
Hi, Santosh.
recording been on?
Yeah, it is already started.
Oh, okay, all right. I thought that we should start recording when everybody has joined. So you know what we talk before the seminar, it doesn't get recorded. Hi, Darren. We haven't met. We are the two odd people out who have the issue in making for the meeting, the timing, opposite timings. So we have 10. That's good. And thanks, Nasim, for putting. But that was the idea from the onset, isn't it? We wanted you to chair the session so that you have this experience. So that's good for you. Do we want to stay after the seminar? Because I don't know, have we scheduled a meeting, our meeting for the group?
Not really. I mean, today we can stay. I mean, if all agreed.
I mean, I don't mind because it's really a struggle to, make the
Yeah.
time. So
Yeah, we can
if
meet
we
some
have,
other day.
yeah.
The time.
So check with others if they have the time, then we can do. I mean, I'm okay.
I'm okay to stay for about 30 minutes afterwards. So that'd be good for me, Santosh, as well.
Okay, that's good.
Thank
Yep.
you.
We better make use of this time when we
Yes,
have set
yeah.
aside rather than bothering about another email and then finding out the time. This is really stressful for me.
Much easier, isn't it? Yeah, much easier.
Time zone is really a issue. Time zone really.
So do you start, Professor?
Yeah, we can start.
I did not hear.
It's a yes. You can start.
Okay,
We can
great.
hear.
Okay, great. So good morning, good afternoon, good evening. Since we have joined from different parts of the world, and welcome to this online seminar organized by Scientific Group Number 3, Climate Mobility, Migrants and Health of the Asian Population Association. My name is Nasim, and I am from University of Warsaw, Poland, and I will be serving as the moderator for today's session. So today's seminar titled is Climate-Related Health Vulnerabilities and Access Barrier Among Migrant Population, a topic of growing importance across the Asia-Pacific region. And before inviting our distinguished speaker, I would like to invite Professor Bhagat to introduce us the scientific group number 3 of the Asian Population Association.
So thank you, Naseem, and good afternoon, good morning, good evening to all of you. So I first of all extend very warm welcome to all of you, and this is our second webinar on the topic climate mobility, migrants, and health. Just to let you know that our first webinar was delivered by. It's not audible?
Yeah, your voice is not coming, although it is not on mute, but it is not.
But I can hear him perfectly.
Okay.
I think there's some
maybe
issue at your end because
Naseem,
when you said yes, you didn't get that. So something at your end. I can hear him perfectly.
Good for me too. Good for me too.
Thank you. Thank you. So our first webinar was delivered by Dr. Roman Hoffman, and it was very interesting. And the topic was climate change and human mobility, global insight into the complex relationship. And in that series, we have today another lecture, the second lecture by Professor Ruttiya Bhula-or, and who has kindly accepted our invitation. And she is going to talk about climate-related health vulnerabilities in Thailand. So it's very interesting. One more activities which is in pipeline, and let me invite all of you that we have from the group have made a call of papers in a special issue of Journal of Population Research. Please do submit the papers. Journal will be published very soon, and Professor Santosh Jatrana is the chief editor of the journal and who is here. And I also take this opportunity to thank group members who have been supporting and working very arduously for the last 6 and more months. So Professor Santosh Jatrana from Deakin University, Darren Smith from Loughborough University, UK, Muhammad Manuel Islam from Dhaka University, and Naseem from now University of Warsaw, and I am Rambi Bhagat, who has served International Institute for Population Sciences, Mumbai, for more than 3 decades. So I have opportunity and support of chairing this scientific group. So thank you very much and welcome to all of you. Now I hand over to Naseem. Naseem, please go ahead.
Yeah, thank you. So now it's really my pleasure to introduce our speaker, Assistant Professor Ruttiya Bhula-or, a faculty member of at the College of Population Studies, Chulalongkorn University, Thailand. She holds degrees in economics from Chulalongkorn University and pursued advanced studies in frontier science at the University of Tokyo. Professor Ruttiya currently serves as the Director of the Labor Research and Coordination Research Unit at the Chulalongkorn University. She is the country lead for Thailand at the Global Labour Organization and a member of the expert group of the Asian Center of Active Aging and Innovation. Her research spans labor, migration, aging, and health system. Notably, she is currently serving as an assistant editor of International Migration Review, one of the leading journals in the field, and she is truly the ideal person to speak on today's topic. So please join me welcoming Professor Ruttiya. So floor is yours.
Thank you very much for giving me opportunities. I'm really really feeling honored to be here and have a chance to join the research group, discussion here. So what I'm going to present today is the ongoing work focusing on what could be the access barriers among migrants, especially in Thailand, and is the work that jointly produced with the health development funds in Thailand. So at the final paper, this going to be brought into the policy actions, and do hope that today's presentation will also bring a very comprehensive, discussion among with through this knowledge sharing and the discussion. So let me start with the overview, but I'm sure that all of you understand and recognize the linkages between climate change and migration. So, but the climate is clear to be the threat multiplier, and it is also clear that is enhance the forced displacement and legal location. It also contribute to voluntary and active migration as well. And migration serve as an adaptive strategy. So in a sense, the migration and climate change has a very close connection between these two components. And in connection to that, the health outcomes is a very important part of the impact of climate change on every single populations. But for those who are more vulnerable, will be impacted largely through the lower adaptive capacity. And for that, there are actually a numbers of literature mentioning about the impact of climate change on people, including migrants. The impact includes the increased infectious and vector-borne disease, the excavations of NCD due to the disrupted care, and the mental health impact is clear in the mental health impacts and the heat-related illness, especially those who are working in 3D sectors, which obviously are migrant workers. And limited recognitions of early symptoms and fear of financial legal consequences also expand the word and morbidity and the impact on them, especially this being found in the Thai case. While we have a number of literatures, but one thing that we quite need more discussion would be the link into the health vulnerability, especially the access to the health services. And therefore, this presentation, this ongoing work, is focusing on how institutional policy dynamic will shape climate-related health inequalities. And this has to be highlighted that Thailand is an interesting case in the sense that it's representing a region, a country with one of the most prone in flood, and is according to the recent work with World Bank, it's clear that like 40 to 60% of the area provinces in Thailand are prone to flood. Of course, it would be different on the areas, but it's also identified the very high risks in terms of flood, and not only that, also the risks from the drought and the coastal erosions. So the framework for this study is focusing on the accessibility to health. Therefore, we start with the possible impact to health or the health vulnerability, starting from the possible impact through the individual lifestyle or the baseline of each individuals, and then connect to the social and community network, and of course, the general socioeconomic, cultural, environmental conditions would impact on this. But with the focus on the healthcare services, and the migrants are usually being limited in accessing to such healthcare services. And with this focus, we highlight on the higher vulnerability in terms of sensitivity and their adaptive capacity, which is framed by availability of health and accessibility. In doing so, therefore, it also being highlighted that the vulnerability is the combinations of sensitivity and adaptive capacity, and that also being largely contributed through the health system with the public's design health system, like especially the adaptive capacity, which contribute to the ability to access to health services in healthcare. Then actually, in terms of the global recognitions on the linkage between the climate resilience and the migrant inclusive health system are increasingly on debate. But at the same time, in terms of the difficulty in access into those health services remain challenges. Like there are likely to be, the health system are likely to be underfinanced, the weak implemented capacity and limited data system, as well as if insufficient focus on vulnerable groups, because they're likely to prioritize on local people first. And it's also being contributed by the double knowledge gaps of the migrant workers themselves as well. In terms of the setting, Thailand is hosting a large migrant populations from migrants from the neighboring countries, especially from Myanmar, Laos, Cambodia, Vietnam, and those according to the total population in Thailand, which is around 67, we have about 4 to 5 migrants and staying in Thailand according to the UN estimates for the migrant stock. And in terms of the health reform, we have the universal healthcare system, but at the same time, it still remains the challenge in accessing to the health system through by the vulnerable group, like minority of registered migrants workers to report inadequate service access in Phuket province, which is the tourist one of the famous tourist province, reported that and the migrants here in Phuket, about 15.7% remain facing the unmet healthcare needs. And also, there are the challenges in terms of the public health services and insurance entitlements for the migrants. So, this, as I mentioned, this work is focusing on institutional barriers. So, in that sense, we conduct the focus group and also doing the quantitative questionnaire with the key informants from the researchers and key policymakers in migrations area. We apply the ICAT guideline, which include the institutional readiness, the monitoring and evaluation framework for adaptation, the coordination across sector, and the transparency and accountability in the climate related plan, especially those that connected between migration and the health accessibility. And following the questionnaire, we also conduct the focus group. And by the questionnaire completion and semi-structured discussion, we actually, within this presentation, we combine three key informants from those who are working directly with migrants and those who are the key policymaker with social and healthcare providers, and as well as those who are the key policy planner in Thailand. So based on our work, then we having providing these two key point or in kinds of like hazard and the sensitivity that would be increased by the the climate change to the policymakers and key informants perspective, and plus the adaptive capacity gaps due to the inaccessibility into the institutional framework. So let's start from the first one. For this, it is clear that the health exposure and the hazard from health and flooding in Thailand would be the priority, especially among migrants who are working in the 3D sectors. And it is also clear that within these risks and this heat hazard would be enhancing and increasing the probability of being dizzy and weak. And one more thing being added into this is the longer hours of work because of the lower, productivity at a certain point of time. Then we found that a numbers of work, including like domestic work in the household, that would require longer hours of work in order to achieve and finish their assigned jobs. And it's also clear as well that in terms of the impact is not just only on the heat into the direct impact on health, but also impact through the indirect channels, especially through the recovery channel. I mean, like for those who might be impacted through the income, which would be the indirect impact on the capability and capacity to cope with climate change. And the sensitivity also increased because the health vulnerabilities because there's no special measure for migrants to lose the document, especially in the floods, and there is no clear on the health services become a system for the local for overall, if it is the baseline, then it's also enhance the problematic and the challenges on the migrants. And also, there's no warning system in migrant languages. Worker go to the doctor, but they cannot diagnose agnostic to be the conditions of the climate change. And also, this is a very important point that during the increase of the incidence of climate change, the migrant children become even more visible because they are facing the difficulty in terms of the document and the lower income of the migrants' parents. And here is the key part of the institutional assessment. First of all, this is clear that in terms of the migrant inclusive health action is moderately low. If we take the Thailand as the developing country, it is clear that the goal and strategy domain are still being limited in terms of translation into operational mechanism. I think it's also quite similar to other regions as well. And there is a clear weakness domain on monitoring and evaluation, and even among the focus group itself, it's also clear that they don't know how to monitor. So there is a very huge gap in linking between the health outcomes and the climate change, and therefore the way of preparing into these kinds of policy being really weak. And it's also highlight the uneven capacity among the policymakers organization, which include both plan organization doing R&D plans, contributing to the national plan up to the ministry. And it is clear that this even within the head between the head quarters for this the organization, they still have a very huge understanding toward the impacts of health on through climate change. So right now, in terms of the awareness, they're really aware that climate change is happening, but there is no clear how they can work and also how to measure the impact. Therefore, it is a huge gaps between the policies and the implementation, which definitely through the monitoring and evaluation. So it is very important to developing this baseline and ensuring that every group of population being monitored. Is to just highlight even more on this, it is clear from the focus group that there are also mainly policymakers themselves also suffering from the inability to identify clearly how climate change affect on health. And there is no clear data as of now, and there is a lack of political leadership. Even in Thailand, we announced that we're going to have the zero, CO2 by this few years, but there still have, since the government being rapidly changed over time, so the political leaderships need more sustained and more longer term to make sure that it can be implemented effectively. And it's also right now, the geographic and politics things around right here right now is even made this more difficult because make the migrants being hesitant to access to service and numbers of service provider also feeling like there could be a kind of increased barrier between the local and the migrants. Then based on this data collection, it is clear that migrants' climate health are chronic, accumulated, and multidimensional, and vulnerability is becoming increased on top of their own vulnerability, like the limited ability in language barriers or low health literacy. And they're also working in the very high risk, high hazard sector. I like to highlight as well that migrant children, many times when we talk about the impact on migrant workers or migrants, there we are not really much talking about their families, but there is actually impact on the migrant children themselves and also actually impact on the left behind people in the country of sending as well. Then it's like the migrants themselves become more like a sandwich population needing to looking at themselves and then making sure that they can tackle with this challenge, but at the same time will have a higher expenses at the country of the sending country. Also, the survey plus the focus group clearly indicate that we have a weak surveillance, and there would be a need, especially to highlight on M&E capacity and strengthen the climate impacts on health and the KPI, or make it more visible so that it will help in terms of implementations. So Yeah, I think that's the last point I'd like to highlight is that the adaptive capacity is central bottleneck, and it is clear that we need to strengthen the link between, the policy and the implementation. Thank you.
Uh, Thank you so much, Professor Ruttiya Bhula, for such an amazing presentation. Uh, Once again, I would like to express our sincere gratitude to Professor Ruttiya for sharing her valuable expertise with us today. This seminar has given us much to reflect on, particularly as climate, mobility, and migrant health continue to be pressing issue across our region. And I'd like to thank uh, Asian Population Association for providing all kind of facilities, and scientific group number 3 for organizing the important seminar. But before final going to the question answer session, okay, let us do the question answer session first, and then we have one more announcement from Professor Jatrana. So yeah, we have around 27 minutes for the question answer session. Does anybody have any questions?
No,
Okay,
Nassim, can
yeah,
I begin? Sorry, I can't.
yeah,
Sorry, I can't. Apologies, I can't find the hand on the screen, so I put my hand up to ask a question physically. Sorry. Thank you. It was a fascinating presentation. I really enjoyed it, and I learned lots about climate change and induced migration in Thailand. So thank you. I have two questions. I don't know if the questions are observations. But I think one of the key messages I took away from the talk was the need for better migration statistics in Thailand, and capturing migration statistics. I think you used the word institutional blind spots and institutionally invisible. I think that's what you were referring to, if I understand that correctly. So my question is, do you have any recommendations how better migration data could be captured for informing health policymakers? So that would be my first question. And kind of partly related to that, I think, is my second question. I really liked your framework. I think it was on the third slide, the framework that you presented. And I noticed on there you didn't have the word family or household on the framework. And given the discussion of migrant children that you explored, I just wonder whether you think how important is family in terms of the migrants that are active and coming in and also depopulating particular parts of Thailand. I hope that made sense.
I'm not sure. Can I have your second question again, please? I mean,
So my second question is how important is a family perspective?
Okay.
Is it a key is it one of the key variables, one of the key factors that's important for thinking about health vulnerabilities?
Yes,
Thank you.
Thank you very much. So let me start from the first one. Yeah, you really you perfectly identify the key part here on the institutional blind spot. And it's not, we are facing a numbers of, I mean, in Thailand, we are facing the numbers of illegal migrants without document, and that's the baseline of the migrant situation in Thailand. And along with this blind spot, there are two degree of the blind spot. The first one is on the migrant vulnerability due to the non-documented and illegal status. On top of that would be the blind spot on how can they access to the climate change, the health accessibility. And with under that, I think the key point is how to light or shade the light on the how we can measure the impact of the on the linkage of the climate change on health of those migrants. So yeah, there are numbers of data and monitoring evaluation mechanism that need to be developed. Yeah, I'm not sure. This is yeah, and it would be great if you have more points. I think is really we appreciate the way that highlight. And the second question, yes. When we talk about, to my knowledge, when we explore the literature, when we talk about the impact on migrant workers, on migrant populations, we're likely to talking about only the migrant themselves. But actually, we're talking about human beings. So we need to understand that we talk about their own families and not just only the family in the country of destination, but the family in the country of origin as well. So it's clear from the data collection that actually my grandchildren in the country of destination, they're facing the similar challenges as their parents, my grandparents. But at the same time, there are also a numbers of them having children in a country of origin. And for that, it's even more worrisome for them because if then at the country of origin face the climate change, it means that they need to react to or helping or responding to um that incidents. So yeah, family should be extended uh, into the framework.
Thank you. Thank you.
Thank you so much.
Thank you.
Oh, should I ask questions there?
Yeah,
Hello?
please go ahead.
Go ahead.
Yes. Yeah, I have a question and one, not question at all, it's a clarification. So I am interested in methodology part. How do you link the climate change with migration health status? That means I am a bit queries, that means inquisitive about that. How do you link that? First. Second thing, migration, health of the migration, health issues among the migrant and migrant children. I think it's you are trying to link with the global climate change or climate change of Thailand, the broader perspectives. So I think if you, it's my comment that I think if you improve the work environment through the policy initiation, that will be the better rather than when you linking with this Thailand climate change, it will be the greater political. That means you are trying to link with the global, bigger issues, states climate change issues. I think it's nothing but if you relate with improve the work health, work environment, then I think you can solve it. I would like to hear from you more details about that. These are my question, or you can say queries also.
Thank you very much. This allow me to clarify a little bit more on the methodology. And I think for the first question, those who are key informants are identified by the key people in from the ministry. They are representative from the ministries that working closely or working under the migrants related issues, plus the researchers who are experienced at having worked on the migration issues for at least 5 years. I'm sorry, I did not put the criteria into this, but yeah, you're really right. I should thank you for asking, so I can clarify more here. And since the climate change is if we ask the migrant workers themselves, what are the impact of climate change, will be mixed with the incidence of the disaster. Therefore, in the climate change itself is more in the we need to understand and having a certain period of time to see the changes. Therefore, the 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 key implements here are already been selected and being screened by the health committees who are funders to this work. And this is to guarantee that we are having the key organization and those and researchers working in this area in particular. And based on that, we expand the analysis by using the survey and plus the focus group, and then within the results being segregated into two parts. Those are researchers or NGOs, CSO who are working in this area for, as mentioned, more than 5 years. They're going to be contributing directly to the part on heart and the sensitivity. But for the adaptability would become from the ministry or those who work in remedials or being responsibility, having the responsibility to the to react to the climate change issues. Like in Thailand, we have Department of Climate Change, like public health, and based on those plans, there also include the term climate change, but of course, with not really much detail on that. But they're accounted to be the key stakeholders in making sure that they can reflect, the impacts and the capacity of institutional capacity as well. I'm not sure if I'm answered your questions. Yeah, but actually, I have one more question from Professor Mystery. And the other thing is to highlight on the impact on to improve the working condition. Yes, this is true. But when we talk about migrants in Thailand, they're actually not only those who are working, who are workers. I mean, as I mentioned, we have about 4 to 5 migrants, including those who are regular and irregular migrants, but only 2 million register, 1 to 2 million register as the migrant workers. So we have quite diversity of the migrants under like this setting. And it's a very important point I should add here as a background as well. Thank you.
Thank you. Thank you so much.
Thank you very much.
Professor Jatrana. Yeah.
Hi, Ruttiya. It was a great presentation. I have many questions, but I would just ask two. And if we had the time, if no one is asking, I can ask more. I have been working on this topic. My work has been on migration and health longitudinally. I recently added climate change to that and developing a proposal. The more I read, the more confused I become, particularly adaptation. Migration has been considered as one of the strategy of climate change, right? With thinking that adaptation is positive, while it may or may not be. Secondly, it's the immobile population. So people may like to stay there despite offering whatever. For example, in Australia, indigenous people, they don't want to move because of their attachment to land, water, all sorts of things, their clan. So my question is like within this framework that you are presenting, what do you reckon? Like adaptation is one thing, but how do you know that, or whether work has been done that the adaptation is positive or negative, or immobility is positive or negative? Because immobility could be good if it is willing, people want to not to move. But if you feel trapped, and this is when I say trapped population, basically who could move? People with high socioeconomic status who have the means and all these things. But women with young children, elderly, people of low socioeconomic group, who don't have the move, they can't move. So it's sort of quite complex. So this is one thing. Second is with the data that Darren raised during the discussion. There was a Lancet study which audited all the data from burden of disease study 2021 or 2022, and they mentioned that Asia and Pacific is one of those regions that they really lack data, and particularly this is on health, okay, because we are doing health. And in fact, some of the countries, particularly for children, 90% of the countries, even globally, they do not have the health of children, mental health particularly, which is climate change impacts more mental health than anything else, because if you have to move all of a sudden, emergency situation, floods or heat waves or whatever. So, are there any work in Thailand, some advocacy work or policy level work that a decision has been made that this is a priority of collecting data? I don't know. I mean, what needs to be done, but data is something that I'm very passionate about, particularly longitudinal data. Thank you. I stop here.
Really appreciate it. Thank you. So yeah, for first point, I think when we talk about adaptation, we likely to think about the ability to adapt, right? But may I say, like in this case, the adaptability, the ability to adapt is actually being framed by the system. I mean, if they can be able to they could have a certain ability to adapt by themselves, by their own family, or, by their surrounding people. But for the health system, it is somehow being like designed by the national level. Therefore, if they can not access to such, public services or health services, then it becomes adaptability deficit. So I think in that sense, it has to be more. I mean, for this work, should be clarify a little bit more on what would be the discussion on adaptability, and I think this really valuable. Thank you very much. And one more thing, and we talk about people who might want to stay. And yeah, I do agree. And it is clear from the literature as well that actually for those who are facing difficulties, facing this natural disaster, would be those who are at the lowest socioeconomic status or health status would prefer to stay at the same place. But it's also being clear that with these kinds of that's why I mentioned about the left behind people, because when we talk about migrants in this sense, it means that or those who are international migrants coming into Thailand who have no Thai, citizens. Therefore, that's why we need to pay more attention to those who cannot move or cannot migrate or and staying in the sending countries. And I think this also very important to highlight in terms of policy implication when we talk about the linkages between country of destination and country of origin, which are also the implications of climate change for both countries. Yeah, and for the mental health, you're right. Yeah, and mental health was the most challenge. Data deficiency, data insufficiency. Yeah, and in Thailand there are some cases just only few limited numbers of sampling sites in documented the mental health, but it's more on the immediate impact. But we really need to have a longitudinal data. Is this clear? And I do agree with you. But we need to have more highlight on that. But in the focus data collection, the mental health will also become clear. But it's like the baseline for everyone here, and it would be even heightened amongst migrants. I'm not sure if this.
Thank you.
Thank you for your question as well.
Naseem, may I intervene?
Yeah, please go ahead, sir.
So thank you very much, Professor Ruttiya. Excellent presentation and ideas, and we have really benefited from your presentation. I have uh, some queries. For example, you mentioned that 4 important sectors: agriculture, fisheries, tourism, construction. So how the labor is procured? Is it entirely irregular migration? If it is a large proportion of irregular migration, then naturally it will be very difficult for them to access a healthcare facility. Then the access to housing becomes very important. Uh, so actually, really, there is a political economy behind it, exploitation, subjugations, and you also know that there is out migration from Thailand also globally. So it's a very paradoxical that Thailand is a where fertility is one of the lowest, aging is accelerating, labor force in terms of own country's labor force in terms of demographic dividend. I understand it is declining. People of Thailand migrating across the world, and then there is a labor shortage certainly in some of the sectors, particularly tourism, fisheries, etc. So you can tell us how this works in terms of labor migration into the country, to what extent irregularity is there, and how these people are competing with the internal migrants of other parts of the country. If you can tell a little bit. Thank you very much.
This is a very challenging question. I think yeah, and the migrant who are come to work in Thailand, as they're like most of them come from neighboring countries, and then they work in the agriculture. Is this clear from the work permit registration? Even is not might not much accurate because we have also a number of the illegal migrants. They're working in agriculture, working as the domestic workers, and frankly, we have a case of to level of the migrants registration. I mean, like for those who are professionals using another sections of law, but for those who are low skill, which account about 90% of the migrants are working in agricultural sector, domestic workers, and the as a labor, and these kinds of occupation are working in fishing, in agriculture, in manufacturing sectors as the low skill workers. Yeah, so it's linked to the labor exploitation definitely, and not in this the focus of this presentation of yet touch to the those who are the forced labor who are being exploited. It's really even more difficult for them to access to the help services here. And yeah, and Thailand is actually also having a numbers of them working abroad as well, especially being working as the lowest and in the low skill, semi-skill categories. But when we talk about the numbers still very lower. It's like less than 1 million. Why we have about 5 million migrant stock in Thailand. So that's why the policy, when we talk about migration policy, the policy makers in Thailand are likely to focus on those who are coming to Thailand rather than those who are sending out. Yes, and that's still the policy gaps. Yeah, I think I'm not sure if I can answer all, but just to share my opinion towards what would be this setting.
Thank you. Thank you.
Thank you very much.
We have around 4 minutes. If we don't have any question, I would like to invite Professor Jatrana. Although Professor Bhagat already mentioned about the call for papers, but still, I can even
I
show
I don't know, but anyway,
the link.
I think I go about it so that it's on record, though it has been mentioned. I think, yeah, that's what I wanted, that we have this call for paper from JPR, a Journal of Population Research on Climate Mobilities, Migrants and Health. This is a special issue, and the last date is submission is 9th March, but I think we need to extend that because so far we didn't have much interest. So please, everybody joining today, feel free to promote this special issue. It's a great opportunity we have. And Ruttiya, I would like that. Why don't you submit your work that you are presenting? It fits very well within this. And also your team and other people, in Thailand. While the focus is on Asia, but we are happy to include paper from other parts, and it would have something for everybody related with this broad topic. So if you could scroll down, Naseem, we have the topics that we include in this. Show more. No,
Yes.
show, yep. So if you look at the themes, drivers of climate change, health and well-being, data and methods, life course perspective, urbanization, policy and governance, basically everything possible under the sun within the broad topic. So yes, we would be very happy to have the contribution, and we'll try to publish won't take after the usual process. It's a priority for us to publish it by the end of the year, but my personal goal is within 6 months, it should be out.
Thank you. I'm
That's
definitely
great.
sharing.
Yep, great. Thanks. Do you
Okay.
work? Can I ask one question to you? Do you work with Vipen? Vipen? Vipen?
Yeah, I know Ivan. She was
Yep.
our deans, but right now we
Yep,
have a
yep,
new
yep.
dean. Yeah.
Okay, all right.
Yeah.
I worked with her. I
I'll
met her
tell her.
recently. I was in Bangkok for PMAC. Please, my doll.
Oh, last what this year
Yep,
or
yep, yep, yep. In January.
oh, pity that I did not meet you. I mean, I should have known you before. I'll
Yeah,
make sure that I
sorry.
won't miss
Yeah,
the next
I met
time.
Surikon. Anyway, yeah, okay. Yeah, nice meeting you.
Nice meeting you. Really honored to meet you all. I mean, to meet you and our colleagues here. Thank you.
So now I think the thanking part. So I'd like to thank the Asian Population Association for providing all kind of facilities, and the scientific group number 3 for organizing this important seminar, and also all of you for taking time to join us today. And please stay connected with our group number 3, and we wish everyone a wonderful, again, morning, afternoon and evening, and thank you. Goodbye. I think I would request only the group members to be here so that we can discuss little bit. Yeah, other people can maybe. Yeah.
Should I leave now?
Yep, you can leave.
Thank you much for your time. I really, really appreciate. Thank you. Hopefully to have a chance to meet us.
Thank you.
Thanks.
Thank you.
So first
Has
we need
everyone
to,
left? Or we still have 8 participants at the moment?
Professor.
Maybe